All righty, good afternoon. Welcome to the April S&P webinar, monthly webinar. This webinar is on how to read your Medicare Summary Notice. And I'm thankful that you all are here today. Glad that you've decided to join us. It's just going to be a relatively short webinar today. I'm going to take up about 30 minutes of your time, but we're going to look at how to read your Medicare Summary Notice. Just to give you an idea of the agenda, we'll look at what is a Medicare Summary Notice or an MSN. What do we do before receiving it? How do we review it? And then what do we do with it after we are done? So my name is Sean Smith. For people who may not know me, I never know who's going to jump on here, but there's some background information on me. Personally, I think I share all the time that I appreciate the opportunity to advocate for people in underserved communities, as well as teach them how to advocate for themselves. And this is why I'm with the S&P. So I'm grateful for the opportunity to serve in this role, and enjoy working with all the folks that are on here that are part of our team. Again, just some more background information about the S&P and why I got started. In the United States, we spend about $800 billion a year on Medicare, and annually we lose about $50 billion to $60 billion on Medicare waste, fraud, and abuse. In Virginia, it looks a little bit like this. We spend about $11 to $12 billion on Medicare annually, and we lose about $1.5 billion estimated in waste, fraud, and abuse, which is why the Senior Medicare Patrol was established. The goal of the Senior Medicare Patrol is to empower and assist Medicare beneficiaries, their families, caregivers, to prevent, detect, and report healthcare errors, fraud, and abuse. And we do that through counseling, outreach, and education. The Senior Medicare Patrol is a national program, and it covers all 50 states plus 4 US territories. And in each of those states and territories, they do education, outreach, and counseling. They each individually host their own 1-800-FRAUD hotline, and they all partner with the Office of the Inspector General in cases of Medicare fraud. It is a grant program, and each state has an entity that secures that grant to run the program. In Virginia, the entity is the Virginia Association for Area Agencies on Aging, and they partner with 22 of the 25 Area Agencies on Aging, or AAAs, throughout the state. All of the programs sponsor community outreach events, as well as provide educational training sessions. And then they also distribute resources to individuals and to groups to help fight fraud. And in any of those presentations or any of those outreach events, we talk about 3 things. We talk about preventing fraud, detecting fraud, and then also reporting fraud. And so that's the mantra for the S&P, is how do we prevent, how do we protect, and how do we report? And this particular presentation is basically focused on really detecting fraud and using your MSN to detect fraud. So again, just a review of the agenda. We're going to talk about what is a Medicare Summary Notice or an MSN. What do we do before we get it? How do we review it once we do get it? And then what do we do after we get it? So let's go ahead and jump on in. All right. So what is a Medicare Summary Notice? So the first thing to know, it is not a bill. It is a notice that people that have original Medicare, they receive every 3 months, and it tells you what's covered or what happens in your Part A and Part B services. So it comes every 3 months to folks that have original Medicare, and it talks about Part A and Part B. In addition, it has all of your services, or should have all of your services, all of your supplies, and all of your suppliers listed on it from the 3-month period that it covers. It tells you what Medicare has paid, and then also tells you the maximum amount that you would owe the provider as a result of the payment agreements between you, Medicare, and the provider. And so that's just some of the information that's in an MSN, but most of the important information that would be in an MSN. You should get your Medicare Summary Notice, again, every 3 months, and it covers a 3-month period. And so, for example, June, July, August, you would get one in September for that 3-month period. And then it covers everything that you've done in that 3-month period. If you've not had any services in that 3-month period, you will not receive a Medicare Summary Notice. So it only covers or only provides services or only comes if you've had services in a particular 3-month period. Now, what you also need to know is that you can receive your MSN electronically. If you have a mymedicare.gov account, you can go online, and every month they will provide a link to your Medicare Summary Notice to you, so you don't have to wait 3 months. So if you go online, open up a mymedicare.gov account, they can send you that link, and you won't have to wait 3 months for a paper copy. But also, if you need the MSN in a different format, they can send it to you in large print or Braille if you need it those ways. So why is reviewing your Medicare Summary Notice important? The big reason is your Medicare Summary Notice really helps in detecting whether or not there's fraudulent or errors on your Medicare account. It is one of the key ways of detecting fraud and errors in Medicare. A Medicare Summary Notice is very similar to a banking statement or a credit card statement. And so as often as you would review those when they arrive, you'd also want to review your Medicare Summary Notice, because this, again, I always tell the story of an individual that we've had call the office saying that they had fraud on their account. They went months without reviewing the Medicare Summary Notice, and literally 6 months. And when they did look at it, it was already too late. They had committed fraud and had limited the benefits of the particular beneficiary. And in addition, once they discovered it, before the beneficiary could go back to the regular services, they had to wait until the investigation was done. So they were coming out of pocket with lots of money for prescriptions because the scammers had utilized her prescription benefits. And so had she been looking at that all along, she would have been in a position to catch it and prevent that from happening, so that she would have to pay those larger fees. So reading it regularly is one of the key ways to preventing fraud. All right, so what should we do before receiving a Medicare Summary Notice? What's really important is that we use a healthcare journal of some type to track important medical information. We at the S&P provide healthcare journals for free. Here's a couple of photos of healthcare journals that we provide. We have the long slim type, we have a booklet type, but we also have a calendar type. And that healthcare tracker helps you to keep up with information that you're going to need to compare to your Medicare Summary Notice. So you use the tracker basically to track things like, one, your appointments, the dates, the times, the physicians that you visited or providers, and then the locations of those services. All of that has a place in the tracker. You also want to make sure you keep track of any supplies, equipment, or services that you've received. If you've received a prescription during that time frame or the time frame of your MSN, you want to make sure you write down the prescriptions as well as which pharmacies you visited to get those prescriptions. And then finally, any bills or payments that you've made, you want to make sure that that's also in the tracker, and keep any receipts that you might have. So your appointments, dates, times, providers, and locations, supplies, equipment, and services, prescriptions and pharmacies, as well as any bills or payments that you've made. Again, all that goes in a tracker and becomes really important when it comes time to review your Medicare Summary Notice. So let's jump into how we actually read a Medicare Summary Notice. So this is a picture of a Medicare Summary Notice, the front page of one, and we're going to go through an entire notice. However, I will say that this is going to be an abbreviated notice because it's for an example only. So it could be 4 pages, or it could be up to 9, 10, 12 pages I've seen, just based on the services that were received. But we'll talk about each section and from a high level, so that you get a clear picture of what you're looking at and what you're looking for. So at the very front page of the notice is going to have your name, your mailing address, and your basic information. You want to make sure, of course, that information is all correct once you receive your notice. In the little gray box below your mailing address, it's going to have your Medicare number, the date that the notice was created, and then the claims, or the time frame in which these claims were processed. So if you look at the bottom, this Medicare Summary Notice covers the time period between June 15th through September 15th. And so that's June to July, that's 1 month. July to August, that's 2 months. August to September is 3 months. And the notice on September 16th, this particular notice was generated and sent out. The next section below talks about your deductible. As you know, if you have Medicare A and B, there's often a deductible, and this tells you exactly where you are with your deductible at the time of this notice. So this says, of course, your Part B deductible, you've met $85 out of your $162 deductible. If you look on the other side of the notice, right on the front page, it tells you the maximum you may have to pay based on the services that you received during this time period. And so that's right on the front page. And then of course, it gives you more detail later. And then below that, of course, are the providers that you visited during that time frame, along with the dates of which you visited those folks. All right. When we open up the inside of the Medicare Summary Notice, page 2 is really general information and will probably be the same for all of the Medicare beneficiaries that are receiving a notice during this particular time frame. So it's real general information. Starts out with just a navigational bar so you know that where you are. This area is called Making the Most of Your Medicare. And then the gray box below really tells you exactly what you should be looking for when you're looking at the Medicare Summary Notice. It asks you, do you recognize the name of each doctor or provider? Did you get the services that are listed? And if you already paid the bill, did you pay the right amount? And again, all of this information is going to be information that matches or should match or should be in your healthcare tracker. So you keep the tracker and you start comparing this information. So they're really telling you what to do with the notice. Below that is a section on what to do if you come across something that might be fraudulent in the report. And they're instructing you to call 1-800-MEDICARE to ask information or ask questions and report that information. When you get to the bottom, it also says if you need help with something or service or doctors or anything happening in the service in this time frame, again, you can reach out to 1-800-MEDICARE for your assistance, for some assistance. When you look at the other side of the notice, again, this is going to be general information. At the top, it's talking about preventative services. And then that section below it is a Medicare message. So imagining that message changes every month or every time, every claim period. And so this one is talking about getting a pneumococcal shot, reporting a change of address, talking about early detection so that you use preventative services, and again, talking about therapy services. So again, this is more of a general page, not necessarily specific to you, but something that many of the Medicare beneficiaries would receive during the same claim period. Now, when we get into page 3, this is the page that starts to get super specific about your services and things that you've received during this particular claim period. So at the top, it starts out by letting you know that this is a Medicare Part B Medicare Summary Notice, and it tells you that Part B insurance helps to pay for doctors, diagnostic tests, ambulance services, and healthcare services. The next section starts defining actually what's below. So if you look at the little grid below across the top, it has different areas. And this section actually helps define those areas. So the first one is whether or not the service is approved. And it just tells you, this column tells you if the Medicare service is covered. The next column talks about the amount provided, the amount the provider charged. And it tells you, again, this is what the provider charges for this service. The next definition is Medicare approved amount. So this is the amount the provider can be paid by Medicare for the service that's provided. And it may be less than the actual amount that the provider charges. When you jump over to the other side of the column, it explains that your provider has agreed to accept this amount as full payment for the services covered by Medicare, and that Medicare usually pays 80% of that amount. So basically Medicare and your physician have agreed upon a rate that Medicare is going to pay for the service they provided, and that will be the full coverage rate. So even though they charge $45, they agreed with Medicare that they only get paid total $28.54. The next column, the definition is talking about the amount Medicare paid. And again, this is the amount that Medicare paid for the provider for the service. And it's usually 80% of the total amount. If you look at the bottom, the total charge that Medicare will pay is $28.54. The amount Medicare will pay is $22.83. So that's about 80%. And then that last column is the maximum amount you may be billed. And that's the other 20% of the $571. So those are definitions for those different columns. We'll look at this gray bar, of course, is the date of the service, the provider that this particular section is talking about. And it also has there the name of the practice and the location of the practice, the street name and the address. And again, that should match what's in your Medicare or your healthcare tracker. Below that, it talks about what services you received at that particular, on that particular date from that provider. And it gives you an explanation. And again, that should match what's also in your tracker. Here it talks about whether or not the service was approved, and there's a big old yes there. And then of course, on the other side, it talks about the maximum amount that you would have to pay. And so of course, the provider charges $45, Medicare and the provider have agreed that they'll pay or they'll receive $28.54. Medicare pays 80% of that. And then the other 20% belongs to you as the beneficiary. Or it may be billed to your Medigap insurance or another insurance that you might have. And so next, you're going to notice a little A at the bottom. And that A refers to a note that's at the bottom of the actual claim. And so whenever you see a letter there, it could be an A, B, C, or D, depending on how many notes are there. But it lets you know exactly what that means. And so as it says here, your claim was sent to your Medicare supplement insurance or your Medigap policy, and it tells you who that is and when they sent it. And it just instructs you to send any questions regarding it to them if you have any. And so all of that is pretty cut and dry. And again, Medicare kind of walks you through all of that. Now, like I said, this is kind of an abbreviated MSN because it only has the one service up here. I've seen this go on for 4, 5, and 6 pages, depending on how many different services an individual has in that particular time frame. And so again, it could be this one page or it could be 20 pages, just depending on, again, the number of services that were provided to an individual during that time frame. So it skips all the other pages and we jump back to the last page of the MSN. And this one, again, is going to be more informational, a little less personal or directed towards you, but it starts out with how to get more information about the claims that were in this particular notice. So it specifically talks about if a claim is denied and instructs you that you can call your provider to get more information to make sure, one, that they completed the claim correctly, and if not, they can resubmit that claim. If that's not the case and you just simply disagree with either the payment decision or the coverage decision or even the payment amount, you can file an appeal. It goes on to say that you have to file it in writing. It has to be filed within 120 days, and they give you the exact date for when it needs to be filed. So it says there, January 14th. So remember, this particular notice came out in September 15th was the last day that this notice covered, and 120 days from that would be January. So January 14th, and it should be 2012, although here it says 2011. And then below that, it lets you know that if you need help filing an appeal, once again, you can contact 1-800-MEDICARE, and they'll be glad to help you with that particular service. Now, on the other side, there's actually an appeal form. And so it instructs you that you can actually send this back to Medicare as your appeal, and it gives you instructions exactly on what to do. So it says circle the services or claims that you disagree with on this notice, explain in writing why you disagree with the claim and include any explanation that you might have. You can use this form and you can attach more paper to it, but you want to fill out this form. And then at the bottom of that form, you'll notice way down there, it tells you exactly where to send the form in order to get that appeal filed. But you have to do it on paper. And again, they provide this right here on your Medicare Summary Notice if you want to utilize this. And so, of course, where to get more information, what happens if you disagree with the coverage decision or a payment decision or a payment amount, and when and how long you have to file your appeal, what to do if you need help filing that appeal, and then, of course, the appeal form if you want to utilize this particular document to file the appeal. And really, that's basically the Medicare Summary Notice in a nutshell. It's pretty cut and dry, and I think Medicare does a really good job at explaining what it is and how to utilize it for your benefit. So now that we've reviewed our Medicare Summary Notice, what do we do with it? So first of all, if everything in your Medicare summary notice is correct and it matches everything that you've had in your healthcare tracker, then it's very simple. You just file it away. And it's important that you do keep it. The way I've seen people utilize an old MSN is they use it as a reference for other information or other services that they may have. For example, we had an individual call that needed some assistance. He has diabetes and he gets a certain two sets of labs each year. Each year, he gets one at the beginning of the year and then one at the middle of the year, every 6 months. And so in 2019, all of his labs were covered by Medicare. It's the same labs, he's been doing it for 5 or 6 years. In 2020, Medicare rejected both sets of labs. So he was able to go back to his Medicare summary notice from the previous year just to see if there were any differences. When he looked at the Medicare summary notice, what he did notice was that the laboratory filed the claim differently in 2020 than they did in 2019. And the way they filed it in 2020, of course, caused the claims to be rejected. So he was able to pretty quickly assess that information. When we called Medicare, they understood exactly what we were talking about. They notified the lab that they were coding incorrectly. They corrected the codes, and then those particular labs were covered. So him having that as a reference made it quick and easy for us to figure out what might be the problem. So again, once, if everything is correct on your MSN, you want to file it away and keep it for future references. If services are denied, again, you call your physician. If you read through your MSN, there's services that are denied, call your physician, make sure they filed everything correctly. If not, have them resubmit that information so that you can make sure your claims get covered. If you don't agree with what's going on, use that MSN to file an appeal, and that appeal form is on there, or you can do it on paper on your own, but that information is there. So if there's something that's incorrect and you don't agree with what's happening, you can file an appeal. Typically, you have 120 days from the time that notice was sent out to you. And then finally, if you think there's something that's super incorrect or fraudulent, you can call 1-800-MEDICARE, the numbers they provide, or you can call the S&P. Either way, in most cases, if you call the S&P, one of the first things that we always do is call 1-800-MEDICARE, either with you or we advise you to do that, or vice versa. When you call the 1-800-MEDICARE to report some type of fraudulent report or activity, they'll always instruct you to call the S&P as well. And so you hit two birds with one stone. What we will do at the S&P is we will assist you also in calling other service providers that you might have to get in touch with, whether it's actually a physician or a Medicare Advantage plan or your laboratory. We can either do that for you, do that with you, or make sure we instruct you. And what we also try to do is try to triage your services or the needs that you might have. So you're not calling 30 places to get to one. We have reference books where we can reference those things pretty quickly and make sure you get to the right place with one phone call. And so we're helpful in that regard, which is why we partner with Medicare and they partner with us. So again, if everything's correct, file it away. If you get denied, then talk with your physician and make sure that they filed everything correctly. If you don't agree, you can file an appeal. And if you think it's fraudulent, you can reach out to the S&P or 1-800-MEDICARE for help and support. And that's pretty much the presentation for today. I'm going to go ahead and open up the floor to any questions you might have. So if you have a question, raise your hand on your computer and we can answer those questions. Great. David, go ahead and hit your unmute and you should be ready to talk.
Do we have any idea about how come the amount Medicare paid could be substantially less than 80% of the approved amount?
I'm sorry, you're breaking up just a little bit. Do you mind repeating that?
Okay, let me try this again. So I have an MSN where the amount that Medicare paid was something like 30% of the approved amount. Why would it be so much less?
That's a great question. Sometimes I know that sometimes depending on how many services you might receive, I'm going to explain it to you in a better way. Sometimes there are, one, it could be depending upon the service itself, or two, it could be dependent upon the extent of your coverage. And so all those things are really just discussions that you might want to have with your either insurance provider or your Medicare provider, but they can certainly explain it to you. But typically it should be the 80-20 rule, or it could be something, again, with the type of service that you might have received. Is this a new service that you may have had possibly?
No, it's a single service. I've had it for a long time. I mean, frankly, I don't really care because there's no money coming out of my pocket. I was just concerned. I was just, curious why it'd be so much less.
Yeah, I'm not, but they didn't charge you the other 70%.
Oh, no.
Okay,
I didn't pay a penny, and whatever was left over for what I would be billed went to my Medicare policy. So that's not a
got
problem.
yeah, and that may be an agreement with the two insurance companies as well. So
Yeah, probably. Okay, thanks.
no problem. Any other questions? Oh, there's a question in the chat. Let me see if I can pull that up. That is not working for me for some reason. Okay, I can't get the chat open. So if you want to raise your hand and ask, that would be the other way to do it. Okay, but if there are no other questions, just want to make you aware that next month's monthly webinar is on protecting older adults from fraud and financial loss. This session will explore the top frauds affecting seniors in 2020 and examine the financial toll on seniors for those frauds and discuss ways that seniors can protect themselves from future victimization. It's going to be, of course, Wednesday, May 19th at 1 p.m. All of you that are on this particular webinar will get a notice to sign up if you're interested, as well as the regular reminder notices that go out to all of the people on our mailing list. But without further ado, again, as I said, it'll be a short session this time, and I appreciate you all being here. Thank you so much, and I hope you all have a great month. Take care.